seizures, and epilepsy, while relatively uncommon in horses, present a significant diagnostic challenge. Among equine epileptic disorders, juvenile idiopathic epilepsy stands out as a well-characterized condition. It's identified through clinical observation, neurological examination, electroencephalography or EEG, and histopathological examination. But what exactly is juvenile idiopathic epilepsy? In Egyptian Arabian Foals, it manifests early in life, typically between 2 days and 6 months of age, with a median onset at 2 months. What's particularly intriguing is that these foals appear to recover fully, showing no long-term effects by 1 to 2 years of age. Researchers have not identified any sex or coat color predisposition, nor any specific events that trigger the condition. Clinically, juvenile idiopathic epilepsy presents as sudden, generalized tonic-clonic seizures, where the foal loses consciousness without any warning signs. Following a seizure, it's common to observe cortical blindness, disorientation, changes in behavior, difficulty swallowing, and an unsteady gait. Cortical blindness, the most frequently observed sign, can vary in duration from a few minutes to several weeks, but vision typically returns within 24 hours in most foals. Importantly, between seizures, these foals appear neurologically normal. The prognosis for survival and a return to normal physical activity is generally good, provided that complications such as head trauma, corneal ulceration, and aspiration pneumonia are promptly managed. To fully understand and classify epileptic disorders in veterinary medicine, electroencephalography is essential. Juvenile idiopathic epilepsy seems to have a familial component and is suspected to be inherited in an autosomal dominant pattern with a self-limiting course. This study reevaluated epilepsy in Egyptian Arabian foals with juvenile idiopathic epilepsy and determined a focal onset of epileptic discharges in the central vertex with spread to other cortical regions of the brain, resulting in sudden, violent, generalized tonic-clonic seizures with loss of consciousness or focal facial seizures. Epileptic discharges were seen during wakefulness and sleep, but predominantly during sleep, which alpha-2 adrenergic agonists promote in equine species. We can also conclude that epileptic discharges were triggered in most foals with photic stimulation. Juvenile idiopathic epilepsy appears to be inherited as a dominant autosomal trait, likely with incomplete penetrance resulting in some asymptomatic foals based on the presence of epileptic discharges upon EEG examination.